Hi, my name's Dominic Harrison and I'm a clinical myotherapist here at Melbourne Sports and Spinal Medicine Clinic. And today I have the lovely Nat who's come in with some lower back pain. So obviously we would assess Natalie prior to getting her down on the table and clear for any red flags, do a full history. But Nat has just come in with lower back pain. She's got a desk job where she sits for long periods at a time, and this is something that we see a lot of in the clinic and something that we can certainly address using myotherapy techniques, which I can run you through a few of those now. Okay, so some of the techniques we use as myotherapists include dry needling, joint mobilization, deep tissue massage, and in terms of releasing this lower back, and specifically sort of the erector spinae and this quadratus lumborum muscle that is often implicated in lower back pain. What I tend to do with patients is I start by releasing some of the more superficial muscles and using a flat hand. I find that feels really good for the patient. So starting to get some heat and some blood flow into those muscles. And starting to sort of palpate and then get an idea of potentially where the joints along this lumbar are a little bit more restricted. And then we can sort of roll out across the erector spinae muscles and gently start to feel what's known as the transverse processes, which is where this quadratus lumborum muscle has attachment points. And you can often feel the trigger points and the taut bands. And I find in the lower back that it's nice to work quite deep as well as slow and building up to that sort of depth as well. And just checking in with Nat, how's that feeling? Good. And so in this muscle here, there's two superficial trigger points as well as two deeper trigger points, and they refer down into the glute. And the glute is also a muscle that we would work through if someone was experiencing lower back pain. So starting to sort of get a little bit deeper, working through the layers of the muscle, feeling into those trigger points. You can sort of hold into the muscle and release and then go in again. And obviously as the patient starts to get nice and warm, I would go in a little bit deeper and start to use the forearm and the elbow. And generally this gets a pretty good result. And the patient sort of gets up off the table and obviously you reassess, see how the lumbar's moving, and hopefully see a nice decrease in pain and increase in range of movement. Thank you.